Hey there, I'm Scott. I'm a nurse. I'm a former firefighter and EMT, and I need to say something out loud that I'm done saying quietly. Stop calling it burnout. You know the definition. It's exhaustion, it's low productivity, it's a creeping cynicism that just you didn't have on your first year when you got into this profession in the first place. Hospitals are so worried about it now that they have started hiring chief wellness officers. They put yoga mats in the break room. They have these various sessions. They have little carts that they push around with essential oils, things like that. I think those are all great things. I'm a big fan of pizza parties. I love getting together and having a good time with staff. But the problem is when we start calling it burnout, we put the emphasis back on you and we say that you're the problem. You weren't resilient enough. You just need to go through and try this meditation app. You need to try some lavender oil. The problem is that it's not you, but it's what's actually happening to you. And that's what researchers Wendy Dean and Simon Talbot actually found when they put out their article, which you'll find in the description below, and they called it moral injury. And I want you to sit with that phrase for a second because I think it's really impactful. When we call it burnout, we say that this is your fault. When we say it's moral injury, we begin to kind of dive deeper into what that looks like and what that means. So I want you to think about soldiers. Soldiers get this. They go to war, they carry a set of values that they knew to be true, they knew to be real, and they believe in protecting people. And then they're forced to do things or watch things or see things that violate everything that they believe. Because it's not normal to see gunshots. It's not normal to see explosives. It's not normal to deal with, you know, bloody messes, if you will. That's not normal. And then when those soldiers come home and they begin to fall apart, if you will, we slap a label on it, call it PTSD, call it something else, and we move on. But what it actually is moral injury. Nurses carry the same wounds. And you say, well, but how so? Nurses are not like soldiers. You're right, they're not. But nurses are just people with a job. And it's not normal to see codes over and over and over. It's not normal to see traumas over and over and over. It's not it's not normal to deal with pediatric deaths. It's not normal to deal with uh, COVID. It's not normal to deal with whatever the flailing ailment is right now. It's also not normal to walk in every day and be yelled at and screamed at and cussed at or expect to be hit and then expect it as just part of the job. That's not normal. Here's the thing, you went to nursing school to give your patients the care they need. That's it. That's what you went to school for. You did not go to school to provide the care that an insurance company allows you to provide or the care that fits a certain ratio, a 1 to 4, a 1 to 6, a 1 to 30 ratio or whatever, nursing homes go through and have now. And it's not the care that you just simply squeeze in between your 5 other admissions that you just received this shift. You were trained to see the whole person that's in front of you. Whoever that is, whatever that is, that's what you were trained to do. Then you get to your job and you get the real assignment, the 6 patients, the 8 patients, the 12 patients, whatever it is. And you get a charting system that's built to do that, but it's really been built for billing instead of the people that are in front of that nurse, in front of you. And now you have a whole call light system that's just going off the entire shift. You have Voceras that you're wearing that are constantly alarming. You have providers who are constantly calling you or messaging you or texting you. That's not normal. And you weren't trained to do this fast enough. You just weren't. You weren't trained to do it fast enough. And that's why, you get called in. You're like, well, you're not keeping up to the speed, or you need to get better. You need to get faster. And I think you all know that moment. You know it way too well. Because what you are supposed to do is looking at your patient's face while they tell you their biggest fears about tomorrow. Because surgery is not normal. Being given a diagnosis of cancer is not normal. Um, Being told that your loved one may not come home from the hospital is not normal. And we weren't trained for that. Instead, now you're staring at a screen and you're clicking boxes because that's what the hospital tells you to do, because that's how they get paid. And eventually, that's how you get paid. And through some of that, tell me how that doesn't wreck something inside of you. It did for me. And the thing that nobody wants to say out loud is that nurses are often the most driven, compassionate, devoted people you'll ever meet. And you don't just stumble into this job because it's part of who you are. You sacrificed your 20s for it, or your 30s, or your 40s, or your 50s for it. You sacrifice holidays and sleep, your own health, sometimes even your own family time, because you believe that doing something, you believe that doing this was more important than just the paycheck. And I think you know that. And it's not a weakness. It's not a weakness at all. That's about as human and about as high as human motivation can get. And then you walk into your work, you walk into the hospital, and you face this system that seems to just run completely opposite of all those values. So, what happens to a good nurse when you're in a broken system and you can't fix the system, but you still have to survive it anyway? What happens? Well, I think you adapt. And you adapt some more. And you adapt some more. And eventually, somewhere along the line, after adapting over and over and over, and doing break fix after break fix and break fix, you eventually break. And that's the part that they want to call burnout. And maybe if you want to use that term, that's fine. But I don't want to call it burnout because it's not burnout. It's the gap between what you believe care should look like and the care you're allowed to give. And you're in this gap, you're in this weird fit of how to make this work. And so the next time an administrator wants to hand you a pamphlet or send you to the break room and point to a flyer that's on the wall and tell you that, well, that's the number you call for burnout, tell them, no, that's moral injury. I think we have this all backwards. Because you can't treat a wound if you keep calling it the wrong thing. You can't keep treating an emotional mental health need with physical goods. You say, what do you mean by that? Well, you can't fix. That's assuming something's broken, but you can't resolve, you can't address moral injury if we just want to keep giving pizza parties. And if we just want to keep giving chocolate or hospital labeled merchandise. Again, none of those things are bad. Please hear that. They're okay. You're allowed to do that. But the problem is that we're treating the wrong things with the wrong things. It's an apples and oranges conversation. You change the system that's causing the problem, and then we readdress everything. That's how you fix this. You fix the charting system so that it actually serves the patient relationship, so a nurse can sit down and have a conversation with a patient instead of just being eaten alive by it. You create environments where a nurse is sitting next to a patient and they are allowed to talk and communicate with that patient and not standing against a wall with their back turned towards them because they have to go through and do all this charting every hour, hourly rounding, because we have to get it done. It's just what we do. And it makes the patient feel connected. The patient never feels connected if the nurse has her back to them or standing across the room because she's got 75 other things that she has to do. It doesn't make sense. You take the busy work off of a nurse's plate so there's time for eye contact. You don't just tell them to go sit down and have a conversation with the patient at eye level, but you create the environment with which they can do that. That's how we start to fix these things. You deal with real conflict. Every nurse works inside because you're serving your patient, your own family, and your employer's bottom line. And often you're doing all of this at the same time. And right now, those three things are really just fighting each other. It doesn't work. So When we fix moral injury, all of these other things, they stop fighting and it just naturally flows and it naturally just works together. You get to do right by your own patient. You get to go home on time. You still get to make rent. It just works. And it's not really too much to ask. It's just the job and the environment working the way they're supposed to do it. And it's why they get called frontline staff. The same phrase gets used for soldiers. They're on the front line. And unfortunately, they're treated as expendable people. And that's not appropriate because these people are not expendable. They might be numbers on a data sheet. Totally get that. But the same person providing care to that lady in room 214 is just as important as the person in the office who is the CEO or the president or whatever of that organization. They're both humans. They both still have to be treated appropriately. They both deserve dignity and respect. But when we treat frontline staff as though they're expendable and we just expect people to normalize bad behavior, bad environments, bad processes, and then we wonder why they're messed up and we treat them like they're just castaways, that's not appropriate. I will say this. Soldiers who come home, who are veterans, they have access to good, high-quality care for their PTSD, for their moral injury. Healthcare workers don't get the same benefit. So why is that? So we use this language from combat, and we need to stop pretending that our wounds in healthcare are not real too, because they are. The reality is that you are not fragile. You are not weak. You are simply carrying an injury that this profession still refuses to name appropriately. So here's the ask. Stop letting leadership put band-aids on burnout and just simply call it a day. Stop letting anyone tell you that suffering nurses are just entitled or dramatic, or that crying in the break room is normal. That's not normal. I don't think it's ever been normal. So why have we normalized it? Why is it okay to go cry in the break room, cry in the supply room, cry in the EMS bay? Why is that normal? Why is that okay? I don't think it is. And why are nurse suicide rates, first responder suicide rates, soldier suicide rates, physician suicide rates, they've all continued to climb, and they've even got worse since COVID. Why is that? It's not you. Please understand it's the system. And it's time that we actually fixed it. It's time we did something about it. So send it to your manager. Send this video. If this actually made sense to you, if this resonated with you, send it to your manager, your CNO, somebody else in your organization who cares or who needs to hear it. We need people in all levels of leadership, from frontline staff all the way to the top floor. Everyone needs to be seeing this, and they all need to hear it. So let's stop calling it burnout today. I'm Scott McKnight. I'm a nurse. I'm a former firefighter and EMT, and I wrote a book called Normal Responses. It goes a lot more into detail about things that I can't cover here in this video, but about the things that we should be normalizing and the things that we need to stop normalizing. On the next video, I'm going to go a little bit more in detail about what violence in the workplace looks like, what you should be doing, and if you're not, what questions to begin asking.